Our study focuses in understanding the uncertainty and unwillingness towards COVID-19 vaccination in Puerto Rico. As we all know, COVID-19 has been a global health emergency for more than a year, and it has disproportionately affected minority populations. This public health emergency is of great importance to Puerto Rico, given that our population is largely of Hispanic heritage and we have one of the highest poverty rates in the United States. The control of the pandemic relies on acquiring herd immunity through vaccination, but there are concerns about the novelty of the COVID-19 vaccines, which may impact actual vaccination efforts. According to the CDC, Puerto Rico has the second lowest overall COVID-19 vaccination rate nationwide. And because of this, we investigated the beliefs, barriers, and facilitators towards COVID-19 vaccination in adults in Puerto Rico. We use the health belief model as a framework to understand health behaviors by examining the perceptions about COVID-19 susceptibility and severity and vaccination benefits, barriers, and cues to action. To answer our research question, we conducted a cross-sectional study in adults and collected data through an online survey. Overall, over 1,900 individuals completed the survey, of which the majority were women and individuals of higher socioeconomic status. 82.5% had an intent to get vaccinated, while 6.5% were unwilling and 11% were uncertain. Although perceived COVID-19 susceptibility and severity were high, a substantial proportion of adults reported vaccination barriers, with approximately 40% reporting concerns about vaccine safety, efficacy, and side effects. The most common reported cue to get vaccinated was receiving enough information about the vaccine. Low perceived COVID-19 susceptibility and severity and low vaccination benefits were significantly associated with unwillingness and uncertainty to get vaccinated. Similarly, vaccination barriers and insufficient information about the vaccine were associated with unwillingness and uncertainty. Among the top reasons for vaccination unwillingness and uncertainty were vaccine safety, efficacy, novelty, rigor of testing, and lack of trust in the government. In summary, we documented determinants of vaccination willingness and uncertainty and concerns over vaccine safety, efficacy, and novelty that need to be addressed in public health messaging to improve the uptake of the COVID-19 vaccine in Puerto Rico.